Hi, I'm Jackie Andraka with The Scoop. I'm here with Barrett Larson, who is going to be one of the speakers. So I see we have some interesting health tech here. So how about you tell us a little bit about it?
Sure, definitely. Yeah, so this is a system that's designed to help prevent hospital-acquired pressure ulcers. So what we have here is a single-use disposable wireless sensor that is put onto patients that are at risk for pressure ulcers. And what the sensor does is continuously monitor the surface pressure distribution over the patient's various body surfaces, and it will alert staff if a patient is in need of a required turn, so that they can reposition the patient and relieve a pressure insult that may have occurred.
Wow.
In order to reduce pressure ulcer rates.
Cool.
Yeah.
So what are pressure ulcers?
Oh yeah, pressure ulcers. So pressure ulcers are actually very common. They're also commonly known as bed sores. And what happens is when patients lie in bed for long periods of time, the sustained pressure actually causes some tissue damage. And the tissue damage can actually be quite severe. Pressure ulcers initially just start as an area of redness, but if left untreated, they can evolve into full thickness wounds that actually extend all the way down to the bone.
Wow.
And they're actually very common. So about 1 out of every 30 hospitalized patients will end up developing a hospital-acquired pressure ulcer.
Yeah.
And they're very expensive to treat as well.
So this technology helps prevent that by telling you when to turn them.
Essentially, yeah. And it helps coordinate turning protocols. So one of the most commonly used ways of preventing pressure ulcers is to use a turning protocol. So patients at risk for pressure ulcers are supposed to be turned and repositioned every 2 hours around the clock. But study after study has shown that compliance with these prescribed turning protocols is actually fairly poor. So what this system does is help monitor, coordinate, optimize, and customize turning efforts for large groups of patients. So it ensures that everybody is turned when they need to be, and it helps improve nursing efficiency as well.
Sweet. So could you give us what is all this right here?
Yeah, so this is our user interface. So the patient sensor here, which is applied to anywhere on the patient's thorax, ends up communicating first to a relay antenna, which we have now just hooked in directly into a computer, but these can be placed anywhere throughout a monitoring environment. And then the data is communicated ultimately to a central server, and from the server, the data is displayed on any web-enabled device, such as a tablet, a computer, or even a cell phone. And what it does is, at a glance, it allows providers to see any patient that's in need of assistance. So.
Awesome. Now, what's the most exciting thing happening in health tech nowadays?
I'm a huge fan of wearables. I mean, there's the market for wearables is booming right now, and I think there's really a place for wearables in the patient care environment, and that's what we're trying to do. We're trying to see if we can create an environment where wearables help improve diagnostic capabilities and therapeutic outcomes. So for me personally, that's what I'm most excited about. Yeah.
Sweet. Well, thank you so much.
Sure.
Awesome. With The Scoop, I'm Jackie Andraka.